Hi, Dr. Chris here. How you doing? I hope you're all safe and well. I'd like to share with you a little bit more information about how to keep everything clean and virus-free, at least as much as we possibly can. And there are two tools that I recommend. Number one is the wipe, and number two is going to be either the spray or the aerosol. And these two weapons, if you will, are very, very good at killing the virus. This is kind of how it should work. I recommend that you get the Clorox wipes, not the ones that have bleach in them, but the non-bleach wipes, and use them to wipe off surfaces. Okay, it's important to leave the surface wet for about 1 minute, and before you do the next step that I'm about to tell you about, and that's using the spray. I would spray on top of that and let that sit really between 2 and 10 minutes. If you use the Lysol brand, you should be able to get by in less than 5 minutes, just letting it sit there. Don't do anything, and then come back and cleaning that up with like a warm towel or a wet towel or something like that, because it gets a little sticky and gummy if you don't. So those two things. The other question is, people always say, well, the coronavirus is airborne, and the droplets are in the air. And there has been some evidence to show that that's very possible. But one thing you have to know about the aerosols is that the aerosols do not guarantee that on non-hard surfaces or in the air that they will get rid of everything. Okay, it just isn't possible. However, I will say that they do claim and have science to support that they can actually sanitize things that are not hard surfaces. For example, furniture, curtains, the air, etc. And the sanitize means that it's about 98% to 99%, depending on which study you read. Somewhere in that range gets rid of 98 to 99% of all the viruses, bugs, bacteria, etc. And so that's pretty good. So I would recommend that you go through the house and spray some Lysol in the air every once in a while, and try to decrease that the chances of that virus continuing to grow or to live. So thank you for listening. I, again, look forward to seeing you guys. We'll get back with you as soon as we know. We will be on the phone calling you. I know that many of you are excited to come in. Please don't hesitate if you have any problems, and I would love to help. All right. Be safe.